Welcome back, everyone. We're going to continue in our advanced pharmacology series with talking about medications that impact the sympathetic nervous system. As a reminder, medications discussed in this lecture are intended to provide a brief overview of the common medications in the noted area and are for education purposes only. Please remember that the allowed medications, their specific doses, indications, and uses will be subject to individual states, EMS services, and medical control physicians. Always follow your local and state policies, regulations, guidelines, and protocols for specific medications in your service area. If you'll recall back to anatomy and physiology, we talked extensively about the sympathetic nervous system, and we talked in Intro to Pharmacology about medications that were receptor agonist and receptor antagonist. We're going to put some of those concepts into practice today by looking at medications specific to the sympathetic nervous system. In the sympathetic nervous system, we have three receptor types that we focus on. There's actually a fourth that we'll mention briefly here in a few moments, but the predominant receptor types that we talk about are beta 1, beta 2, and alpha. And while each of these receptor sites have effects that are wide-reaching and affect other areas than the specific ones noted here on the screen, for our purposes in EMS, we look at the intended effects of either stimulating or blocking the activation of these receptors. For beta 1 receptors, we're predominantly focused on the impacts with the heart. For beta 2 receptors, we're predominantly focused on impacts with the lungs. And with alpha receptors, we're predominantly concerned with the impacts of the alpha receptors located within the vessels. Here's a table that outlines some of the intended stimulation effects that we look at for each of these receptors. For alpha receptors, we're predominantly looking at the effect of vasoconstriction. Beta 1 receptors, we're looking at increased heart rate. And for the beta receptors that exist in the vessels, we'll also see some vessel constriction or vasoconstriction, increasing the blood pressure. Beta 2 receptors were predominantly focused in the lungs, and the intended stimulation effect of the beta 2 receptor is bronchodilation. The dopaminergic receptors, as we mentioned earlier, have a wide-ranging impact across the body, and when we stimulate them directly, the effects can range from vasodilation all the way to vasoconstriction and increased cardiac contractility, depending on the dose at which we administer this medication. It's important to note that we may have both receptor agonist or receptor antagonist. For example, if we are looking at a beta 1 agonist, that medication would increase the heart rate. If we are looking at an alpha agonist, that medication would cause vasoconstriction. And a beta 2 agonist would cause bronchodilation. We may look at a beta antagonist, also known as a beta blocker medication, to control an increased heart rate. So we may provide a medication like a beta blocker to reduce the heart rate. On this next slide, I'm going to show you a few common medications in each of the receptor areas and how they affect the autonomic nervous system. We can see that we have alpha 1 agonists, such as norepinephrine, dopamine, and phenylephrine. We also have alpha antagonists, which prevent the activation of the alpha site, including phentolamine and haldol. We have alpha 2 agonists, listed here on the top right of the same column, and alpha 2 antagonists. Note that medications aren't exclusive to one or the other. Phentolamine is contained in both of those sites. On the beta 1 antagonist, we have medications that should sound a little more familiar to you, such as dopamine, isoproterenol, dobutamine, and epinephrine. And on the beta 2 antagonist side, again seeing duplicated medications here, isoproterenol, along with terbutaline and albuterol. Some of the beta 2 antagonists that we use, particularly in cardiac patients, you see here are things like labetalol and propranolol. On the dopaminergic antagonist side, you can see dopamine, and on the antagonist side, you can see medications like haldol. Similar impacts can be measured across the cholinergic system as well. As you can see, if we go to the top of the chart here and we move to the cholinergic side, a cholinergic antagonist, atropine, you'll note here. This table contains a lot of medications. Some are relevant to EMS, some not so much. On this chart, I've highlighted some of the more common medications that you'll see within EMS that are relevant to the autonomic nervous system and the sympathetic nervous system. Note there that norepinephrine, dopamine, and phenylephrine are our primary alpha agonists that we see in the pre-hospital world. Our primary beta agonists are medications like dopamine, dobutamine, and epinephrine. Our beta antagonists, labetalol, metoprolol, and atenolol. And our beta-2 agonist, albuterol and isoproterenol, are common medications seen in EMS. While your beta-2 antagonists include things like sotalol, propranolol, and labetalol again. Your dopaminergic receptors include dopamine, and your dopaminergic antagonists include medications like haloperidol. And of course, it's worth mentioning the cholinergic antagonist, atropine.